Hello. Today is day 2 post-operation of the surgery, and I was just going to tell you about my pain level and show you what things look like, so in case you have a similar surgery or all three, you'll know what to expect. So I'll show you the scars right now, the cuts, the incisions, and I am in a lot of pain. I'm doing ibuprofen and acetaminophen around the clock. I'm wearing this belly band to provide stability, but it's very painful. And I think that most of the pain originates around the diastasis recti repair and not necessarily the hernias. So you'll see the 3 incisions that she said she was going to make, which she did. And then there is another 4th one, a little tiny one up here. The surgery was done laparoscopically, and so she utilized an X1 robot to go in and repair the, as I showed you before, the epigastric hernia now and the umbilical hernia, and then the closure of the diastasis, which is what I think is the reason why I'm in such amount of pain, because she went in and sewed the muscles together. She said that lengthwise the diastasis was probably like that long, which say like 5 inches or something like that, and then it was also widthwise about this. It's kind of awkward to do. Maybe like 2.5, 3 inches. So it was a significant gap that she sewed together, and I think that is why I hurt so terribly all throughout my rectus abdominis, maybe even into my transverse abdominis. I feel a considerable amount of pain, probably maybe like around a 6 on that pain continuum, that pain scale. Probably a 6 consistently. I do take a little bit of heavier painkillers at night to sleep, and then through the day it's just round the clock Advil and Tylenol. So yeah, I can feel my core just rocked and totally hurting all through this area. And then, they had to provide some IV fluids and I think utilize some air to make space. So I do have quite a bit of swelling, but I'm hoping that I start to feel a little stronger and things become easier sooner rather than later, because not having your core work properly or not being able to utilize it is very tough. It hurts to raise my voice. It hurts the core. It's hard to get out of bed. It's hard to walk. So much of our day-to-day functions rely on the core, so that kind of sucks that it's not well enough to perform. But anyway, that's what I wanted to show you. And if you ever have a similar surgery, you'll kind of know what to expect. I'm sure the umbilical and the epigastric hernias would hurt a bit, but not like the closure of the muscles with the diastasis. I think that is the cause of the most pain at the moment. She also provided me some pictures of what it looked like to close the diastasis and what it looks like as far as the mesh being in there with the hernia repairs, which is cool. And I have always had an outie belly button. She said that she gave me an innie belly button now. So that'll be interesting. Maybe I'll do another video and show you what it looks like when I take off these gauze and everything. So anyway, that's the surgery post-op day 2.